Okay, today we're going to be doing the head, ears, eyes, nose, and throat health assessment. We're going to start with inspection, looking for facial symmetry, pigmentation, any abnormalities, obvious facial abnormalities, and then we continue on to palpation of the scalp, kind of moving the tissue and feeling for any nodes or cysts or any abnormalities. Also noticing any patterns of hair growth and any involuntary movements that would take place. We also want to notice that the head is supported upright and the patient doesn't have any problem with that. We also want to feel the temporomandibular joint and have the patient open their mouth and feel for any abnormalities in that joint. Next we move on to the eye exam, and this is the time where we would do to check visual acuity with the Snellen chart, but we don't have one today, so we won't be doing that. So we move on to inspection of the eyes. We're just going to pull the lower lids down to view the conjunctiva, making sure it's pink. There's no drainage or pus to be seen. And then we move on to the pupillary light reflex. I'll just have you look straight ahead at me, and we're going to test for both the direct reflex and the consensual in both eyes. Then I'm going to have you look straight ahead at me, and I'm going to have you follow my finger just with your eyes. And then follow my finger to your nose, and this is testing for accommodation. Good. Now we will test for red light reflex. I'll have you just look straight ahead at me, kind of like you're looking past me, and it'll be a little bright. Okay. Next we move on to the lymph nodes, palpating the pre and post auricular lymph nodes, feeling for any swollen lymph nodes, or if the patient complains of any tenderness during palpation. We move back to the occipital area, and then down to the posterior cervical chain and the tonsillar and submandibular areas. And then if you can just bend your chin ahead for me a little bit and down the supraclavicular area, it's easier to get into that area to palpate. Okay, next we'll just do a visual inspection of the trachea, making sure it is midline. And then I'll give you a glass of water, and we're going to feel for and feel your thyroid. Just one moment. And we test for landmarks. We look for or feel for the cricoid cartilage. Okay, and then you can just take a sip of water. Okay. This is also a good time to palpate the carotid arteries, only doing one at a time because we don't want to cut off any oxygen flow to the brain. Next we move on to the ears. We're first going to look at the outer structure of the ears and for any abnormalities that we may see. Looking for pigmentation, any excessive earwax, any kind of trauma or anything to the ear. Then we're going to use our otoscope to look into the eardrum and into the ear, making sure that looks healthy. And I'm going to support his head And keep it so if I'm going to bump anything, I'm going to bump my own hand and not bump the client. This is also a good time to test for hearing. If I can have you cover your right ear and then repeat back to me what I whisper.
25.
And then also do the other ear, if you can cover your other ear for me.
34.
And if I had a tuning fork, this would be the time to do the Weber test, where we would test for any lateralization of hearing to either the right or left ear. You would take the tuning fork and then place it on your forehead, and then if you would notice more sound to one ear or the other. And then we also could do the Rina test, which would test for air and bone conduction, and we would do the same thing with the tuning fork and then place it on your mastoid process, and then place it alongside your ear and make sure that the times that you heard it and stopped hearing it were similar. Next we'll check the nasal cavity. We want to look for any drainage and any abnormalities with the nose, and then if I can have you cover each side of your nose and breathe in and out. We want to make sure that you're able to move air through both nostrils. And then we can take our otoscope and just inspect the visual or the nasal cavity, just making sure that it looks pink and healthy. We want to be careful, if you can just lift your head up a little bit, we want to be careful not to hit the septum because that's a very sensitive area. Once again, I want to kind of support my hand on his cheek. Do the other side. Next, we will take some light to look in the oral cavity. I'll use my pen light here. You just open your mouth and stick your tongue out. You can look back at the tonsillar area. And then along sides, making sure everything looks nice and pink, and no cysts or abscesses. Then can you stick your tongue to the top of your roof of your mouth? And if you can bite down for me. Okay, that concludes our assessment.